eye care has come a long way, and you may be surprised at how new treatments can help everything from dry eyes to vision correction. I am very excited to have New York City-based optometrist Dr. Jennifer Tsai here to tell us more. Welcome to the show.
Thank you so much for having me, Justine.
So very excited. I know that you have a lot of information that maybe we're not aware of. And I know that you are known for embracing new technologies, right? Which is pretty cool. Can you tell me about the new dry eye treatment that also provides facial rejuvenation? I find that very interesting. Can you tell us more about that?
Yep. So at Line of Sight, what we focus on is treatments that help improve dry eyes without relying on medication and maintenance at home that you need to do every single day that's chronic, because there are now new devices that we can bring on from the much often from the aesthetic world that actually help with the dry eye management and improving facial rejuvenation. So you may have heard of IPL.
Yes.
IPL is used primarily for skin. We can treat hyperpigmentation, freckles, sunspots, rosacea. We can now use it around the eyelid region with, protection. But what it's doing is it's helping to reduce inflammation, reducing bacterial overload, but also helping to melt our oil glands that get clogged over time, which is actually what drives dry eyes. And radiofrequency helps with fine lines and wrinkles and dark bags and circles. Please. So who wouldn't want that?
Yeah, I love it. Yeah. So I've also heard that you use Ortho K, right? Yeah. That this is kind of like Invisalign for eyes, which is pretty interesting. I had Invisalign, so it sparks my interest. Tell me more about that.
Yeah, it's that's how I explain it to patients, because they're like, what's Ortho K? What does that mean? I tell patients there really is a non-surgical way to correct your vision that's not LASIK. With Ortho K, it's a custom design mold that's similar to a contact lens, but half the size. You wear this lens to sleep overnight. It actually corrects your vision by gently molding the cornea. By flattening the surface. It's not painful at all. The biggest thing about these lenses, which is what separates it from LASIK, is that it is actually FDA approved to slow down myopia progression, which means nearsighted vision from getting worse. But what we are seeing is with now more screen time,
it all goes back to that, doesn't it?
It does, especially with the pandemic and kids being on screens at a younger age now these days. It's estimated in the next 20 years, half the world will be nearsighted globally. So
oh my gosh.
It's definitely increasing.
What's one last tip you can give for all of us for just healthier eyes?
Yeah. If we think about vision, what is important is to take breaks in front of screens, and breaks imply looking at things further away. Oftentimes we're just staring at a screen. Right. We want to break our focus to look at things at a distance. That's helpful. To take breaks in contact lenses, try to wear glasses, and to blink more often. Our blink rate drops by half when we stare at screens.
Really?
So it's important to blink. People don't.
Blink. Blink. Okay.
Yep. And for eye health, honestly, going to your eye doctor once a year, it's very, very important. Many conditions we can catch without the patient's realizing. We can catch diabetes in the eye first before the patient knows about it. Things like glaucoma, macular degeneration, early cataracts. A lot of concerning things that are very important and oftentimes very asymptomatic until it's a little too late.
Sure.
Yeah.
Wow. Well, this was great information. Thank you so much for being with us.
Thanks for having me.
Of course.